I've been very fortunate to have my research be funded by the Center for Health and Wellbeing. And in my work, I look at how people perceive the pain of others. So I'm interested in thinking about how people understand the experiences of others generally, but specifically related to emotional and physical pain perception, with an eye to thinking about how that kind of research might inform our understanding of existing pain treatment disparities, and also how we might use this kind of basic research in more applied attempts to reduce treatment disparities and to increase equity in medical care very broadly. So, in the first part of my work, I was interested in how people think about the pain of people who come from either a high or a low socioeconomic status background, with the prediction that people might systematically underestimate the pain of lower SES, lower socioeconomic status individuals. So previous research shows that the various social identities that people have affects how their pain is perceived. So people tend to think that Black individuals experience less physical pain in the same situations as white individuals, even though this is false. Gender also shapes pain perception, so people have a tendency to downplay or underestimate the pain that women experience relative to the pain of men. So in my research, I looked at whether the same kind of perceptions might be shaped by socioeconomic status. And so across 5 studies, participants read about either a high or a low SES individual who experienced a lot of different situations of or examples of physical pain, including pain from physical injuries, accidents, and also more related to health and disease. And across all of these studies, people tended to think that in the same situation, a lower SES individual would experience less physical pain, even though there's a lot of research to suggest that that's false, and if anything, the opposite of reality. Across 5 other studies, individual participants again read about either a high or low SES individual, but this time they rated how much emotional pain that person would experience in a series of negative life events, including natural disasters and more everyday negative events. And in all cases, participants thought that the lower SES target would experience less emotional pain as well, mirroring the physical pain results. So these studies suggest that socioeconomic status can also bias pain perception, with people systematically misperceiving and specifically underestimating the physical and emotional pain of lower SES individuals, which might help explain why lower SES individuals are undertreated for both physical pain and emotional pain in mental health care contexts as well. And the second part of my research, I wanted to extend beyond thinking about just how one specific social identity shapes pain perception, I think more holistically. So when people picture someone who is sensitive to pain or is not very sensitive to pain, what are they picturing? Who are they imagining? And what are the multiple identities that that kind of mental representation captures? So for this part of my research, I used a 2-phase reverse correlation paradigm. So in the first phase, you have participants make a series of binary choices between 2 images that have been created by superimposing noise over a base image. So what you're doing basically is randomly generating a lot of different images and having people select who they think of these 2 images is more sensitive to pain. Then you can take all of the images that participants chose when they were choosing who they thought was sensitive to pain, and you can kind of average them together. And I'm glossing over some of the details here, but you average that image together to create a composite image of the average mental representation of someone who is very sensitive to physical pain. And you can take all of the unchosen images and you can average those together to create a mental representation of someone who is not very sensitive to physical pain. And when you do that, you see that those images are not random and they, in fact, differ across a lot of relevant variables that we would be interested in. So when people are picturing somebody who is sensitive to pain, my research suggests that they're picturing a woman who's very feminine, who looks white, who looks relatively high SES, who looks young, who looks thin, who looks smart, who looks healthy, and who even looks more human than someone who is imagined when people think about someone who is not very sensitive to pain. That means that patients have these characteristics might be more likely in health contexts to have their pain be misperceived and underestimated by doctors or the medical professionals that are supposed to be able to accurately assess their pain and treat them. And this research perspective advances basic research by thinking about a more holistic image that people have in their minds when they think about pain sensitivity, and how we can think about multiple intersecting identities and how that might create systematic disparities in the medical healthcare context. And so future work can look at the mental representations of physicians and also maybe research on how to change those representations and make them more reflective of reality, of what's going on in the real world. Thanks.